Today, Africa faces yet another reminder of how quickly infectious diseases can threaten lives, stability, and health security. The ongoing Ebola outbreaks in the Democratic Republic of Congo and Uganda demand rapid, coordinated, and science-driven action. At the African Society for Laboratory Medicine, ASLM, we know that diagnostics are the first and most critical line of defense in any outbreak. Without timely testing, there is no surveillance, no case management, and no effective response. And ASLM remains true and committed to our vision of a healthier Africa through access to quality laboratory and diagnostic services. This is why ASLM, in support of the Ebola Continental Preparedness and Response Plan that emphasizes one plan, one budget, and one team, working under the leadership of the Africa Centers for Disease Control and Prevention, Africa CDC, and with the support of partners, ASLM moved swiftly to support the affected countries. Through our network and highly responsive mechanisms, we have delivered over 6,000 essential Ebola diagnostic kits to the Democratic Republic of Congo. And this has been done within 10 days of the request being made to ASLM. A total support of over 22,000 kits is expected to be sent to the DRC affected regions. These supplies were expedited to ensure that frontline laboratories, especially those in the hardest hit and most remote areas, have what they need to detect cases early and break chains of transmission. We are proud to join hands with the European Union, whose support through the European Union's Health Emergency Preparedness and Response Authority, EU HERA, and under the partnership to accelerate mpox and other outbreaks testing and sequencing in Africa, the PAMTA initiative, has made the delivery of these Ebola kits possible. ASLM would also want to thank the government of Canada's Weapons Threat Reduction Program, whose targeted contribution through ASLM will enable Africa CDC to accelerate surveillance efforts and implement critical biosecurity measures in support of the Signature Initiative to mitigate biological threats in Africa, also known as SIMBA. This timely support has been instrumental in enabling this rapid response. The partners' commitment to global health security and their trust in ASLM's technical and operational capacity make it possible for us to act quickly when lives are at stake. Together, we are demonstrating that coordinated action looks like rapid deployment of diagnostic tools, strengthening laboratory readiness, supporting biosafety and biosecurity, and ensuring that communities receive accurate and timely testing. ASLM will continue to stand with DRC, with Uganda, and all our partners across the continent. We will continue to invest in strong laboratory systems because a safer Africa begins with stronger diagnostics.